healthy and advise you right here on Women Radio. It's 11 minutes past 10 o'clock right here in the studio. And this program airs from 10 a.m. Mondays through Friday. So every Monday to Friday, you see us here learning about our health from specialized doctors on certain issues around the world. My name is Mifolua Akiremi, and today we're talking about something that many parents have noticed, but many of them think, it's not serious, it's not a big deal, I can handle it, right? And this is because a child who snores, this is concerning a child who snores loudly, a child who breathes heavily while sleeping, a child who sleeps with their mouth open every night. I'm sure you might have seen cases like this in our household, and many times we've thought, it's not a big deal, Darius, it's just a child, it's just a child. We want to talk about it today, that is snoring in children normal? We know that it happens in adults, but is snoring in children normal, or could it be a sign of an underlying health issue for the child? Many people associate snoring with adults, and now when we see it in children, well, we know that children snore as well, and sometimes it might point to problems with breathing, with sleep quality. It can be some form of allergies, it can be anything at all, and that's what we want to talk about today. We're asking the question, when parents should stop ignoring snoring, what causes heavy breathing in children? Many of these things are things we're going to be talking about today. Our radio doctor for today is Dr. Olufumi Lola Akinola. She is a consultant pediatrician at St. Ives Family Hospital. She would help us understand what parents should look out for when to seek medical attention as well as regards snoring for their children. The phone lines will be open shortly for you to ask your questions this morning. We're live on YouTube at WFM 91.917, and you can listen from our website as well on www.wfm917.com. Good morning, Dr. Olufumi Lola. How are you today? Doctor, I can't hear you. If you can hear me. Your mic is muted. Dr. Olufumi, your mic is muted.
I'm happy to join you once again this morning.
You're welcome. So good to have you too. You're welcome. Okay. I'll go straight to the conversation. And my first question would be, is snoring in children ever considered normal? Is it normal for children to snore?
I will want to start by defining what snoring is. Snoring is in children is when you hear a hoarse or rattling sound that occurs when air cannot flow freely through the nose or throat during sleep, and it is usually caused by the vibration of throat tissue when as the child breathes. When it is mild, occasional snoring is common, and it is usually harmless and normal. So, occasionally, snoring, it is as well mild,
yes,
and it's harmless. But when you're having habitual or loud snoring, consistent and persistent habitual loud snoring every night, it can be a sign of a blocked airway that can disrupt the child's sleep. So occasionally it is acceptable if it occurs maybe once in a while, but when it is persistent and it is occurring every night and it is loud, then it shows that there is something is wrong in the airway, and this needs to be looked at by the doctor.
Yes. Thank you so much, Doctor. That was very enlightening, especially because many parents do not know this. I'm happy we're having this conversation. Now, at what point should parents become concerned about snoring or heavy breathing in their children? At what point do they get to that they can say, oh, now it's getting serious?
Um, a parent should take his or her child to see a pediatrician, or when you have a pediatric ENT specialist.
Mm.
If you observe the following in your child, when there is persistent snoring, snoring that occurs almost every night or
Mm-hmm.
lasts longer than 3 months, when the snoring is associated with gasping or choking, during sleep, when you notice this child frequently gasps for air, or choke or pauses, breathing for a short period during sleep, when this child is also snoring. Then when you notice associated difficulty with breathing, the child appears to be working hard to breathe while asleep, such as using their chest muscles
Mm.
or sucking, in their stomach when they are breathing. And also when you notice that there is restless sleep, with the child frequently tossing and turning and taking abnormal sleeping position, especially throwing the head back, when sleeping, or when there is heavy mouth bleeding, breathing, then uh, one of the reasons why you should go and see a doctor. Or if there is when there is sleep issue associated with the snoring, you know,
Yes.
when there is excessive daytime sleepiness or frequently falling asleep during
Mm-hmm.
the day. When there is also behavioral issue such as irritability, hyperactivity, or trouble concentrating in this child that is snoring. And also, if you notice poor school performance or
Mm.
social interaction, or if this child start complaining of headache,
Okay.
especially uh, in the early morning. These are some of the signs. It shows that the child is having poor sleep, which is also associated with the snoring. And this child will need to be reviewed by his or her doctor.
Mm. That's really good. That's a lot of signs. And if you're a parent listening, I think you should take note of everything that Dr. Olufumilola just mentioned. Now, what are the most common causes of snoring in children? Why does this happen?
Um, when it comes to snoring in children, the most common causes of snoring is in children is when this child have a large tonsils
Mm.
and adenoids, you know, uh, and this usually occur in children from age 2 years, you know, and older. Even nowadays, we realize some of them are even coming earlier before
Yes.
the age of 2 years. So Large adenoid and tonsil is one of the most common causes of
Mm,
snoring. Then other causes include nasal congestion and allergies,
mm,
such as if this child usually have frequent cold and catarrh, sinus infection,
mhm.
or if there's environmental allergies,
Okay.
such as dust, pets dander, which cause mucus buildup and swollen tissue, leading to temporary snoring. And it can also have an anatomical factor when it comes to the shape of the face or of the upper airways. When you have a narrow palate, a small jaw, a deviated nasal septum, it can restrict the airflow and
Yes.
cause this child to be snoring.
Mm,
And other causes include obesity. When
okay.
you have excessive weight, particularly around the neck, uh, it can put pressure on uh, the airway and the upper airway, causing this child uh, to start snoring.
That's really good, doctor. Thank you so much for sharing that with us. You've mentioned obesity, you've mentioned enlarged tonsils, and so many allergies as well as some of the causes of snoring in children. Thank you so much for that. Now, I want to know, is there a relationship between asthma and nighttime breathing difficulties?
Uh, yes, there is a relationship between asthma
Yes.
and night nighttime uh, difficulty, especially when uh, this child have what you call nocturnal asthma, which occur mostly at night. It's make this child to cough at night. Then there is also associated breathing difficulty, and it's due to what you call bronchospasm. I mean, there is narrowness of the upper airway, airway edema, and this results in a child having symptoms of asthma. And majorly, this is usually caused by when there is environmental uh, allergies.
Yes. That's really profound. Thank you so much, Doctor. Now, how does poor quality sleep affect a child's growth and development? We know that it does affect it, but what are some of the effects of poor quality sleep and in a child's development and growth?
Uh, poor quality poor quality sleeps can affect child uh, growth and development, uh, because poor quality sleep can lead to delayed growth,
Mm-hmm.
uh, learning difficulties, and um, some of the hormones that are supposed to release during sleeps will not be released, and this can affect uh, the growth and development, because these essential growth hormones are mostly released during sleep. And when you have poor quality sleep, these
Yes.
are not released. It also weakens the immune system and impair. Uh, poor quality sleeps weaken the immune system and also impair the brain function.
Mm.
So it can lead to stunted physical growth,
Okay.
weight management issue, reduce attention span, and also affect emotional stability.
Wow, that is really, really good. I'm happy that parents are listening, and it's more important for you to take notes as a parent. Now, are hyperactivity or behavioral issues linked to poor sleep sometimes? Because we have kids who are very hyperactive. So I want us to talk about how hyperactivity and behavioral issues can sometimes be linked to poor sleep.
Uh, just as I mentioned about um sleep and development.
Yes.
Um, so quality sleep, affects during sleep is during the time that the brain, is still working, still functioning. Um, but at least during the time that the sleep, brain also have time to reduce its um, activity.
Mm.
So, and when there is sleep issues, where poor sleep can trigger um and or mimic hyperactive and impulsive behavior, such
Okay.
as ADHD. You know, for children and adults, lack of quality sleep or sleep deprivation leads to an increased daytime hyperactivity, impulsivity, and poor attention, because an exhausted brain struggle to regulate behavior and focus.
Yes.
It's during the time that you are sleeping that though the brain is still functioning, but one way or another is activity are supposed to reduce to minimum. But when
Mm-hmm.
you don't have a good quality sleeps, you know, it sort of exhausts the brain function, and during the daytime, it continue to struggle to regulate the behavior and focus.
Yes.
Then conditions that cause hyperactivity, such as ADHD, make it difficult to wind down. You know, it sort of delay circadian rhythm and physical restlessness.
Hmm.
So this can also lead to insomnia or fragmented sleep. So when you also have sleep disorder, such as obstructive sleep apnea or restless leg syndrome,
Mm.
it can also uh, mirror ADHD symptoms. So if a child is snoring or is not breathing well at night, they often exhibit uh, hyperactive, irritable behavior
Yes.
during the day. So in a way, they are interwoven.
Of course. Of course. Thank you so much for sharing that. Because there's also a case where a lot of children are sleeping throughout the night, but also it feels like they're not having restful sleep, even despite sleeping for many hours. What signs suggest the child is not getting restful sleep, even if they have hours of sleep?
Um, some of them, part of this is what you mentioned as snoring.
Mm,
Snoring, though they will be sleeping, you see most of them be restless, at night, uh, trusting from one position to another. And you see some of them trying to struggle to breathe, during the time that they are sleeping. You know, they either using all their uh, physical activity, muscle during sleep. There should be, I mentioned that brain still function. There should also be exchange of hair,
yes.
during sleep. But when you have obstruction, there won't be proper oxygenation of the lung. So it also sort of also affect the brain. The brain will not get enough oxygen, will not get enough rest. So this sort of affects, this child. I won't allow them to have a good quality sleep.
That's really good. Some children while sleeping, have all of these things that you've mentioned, and their parents are panicking. They don't know what to do, they don't know what to carry, they don't know what to take. Are there some first aid? Is there a first aid we can give to children who we see are using all of their chest and their stomach to breathe while sleeping, or maybe they are restless during their sleep? Is there something a parent can do in the meantime before taking them to the hospital, maybe during the night?
One of the uh, first thing that parents can do is to change position. You know, this may sort of reduce the snoring or the restlessness
Yes.
for um, for a short time, and so that this child can have a good quality sleeps. And at the same time, as soon as possible, let the parents need to go and see their doctor so that they find the cause of the sleeplessness or the cause of the snoring, and this should be taken care uh, of as soon as possible.
Mm. Thank you so much, doctor, for sharing that as well. Now, I also want to ask that is mouth breathing during sleep a sign of something deeper? Because many times when these children cannot, I know that it has some respiratory effects. But what are some of the deeper issues related to mouth breathing during sleep, and what can we do to avoid or reduce it?
Um, we mentioned that one of the things, when a child is mouth breathing during sleep, uh, it shows that this child is not getting um, enough uh, enough hair uh,
Yes.
during sleep. It leads to dry mouth, which can um, cause severe morning breath. It can lead to tooth decay. It can lead to gum disease.
Mm.
It promotes snoring and promotes fragmented sleep and reduce oxygen intake. And just as I mentioned before, it does not encourage good quality sleep, and it leads to daytime fatigue.
Yes.
And it can also alter the facial development, uh, of the child.
Hmm.
So to effectively address nighttime mouth breathing, it is important to identify the underlying cause.
Yes.
The most common culprits includes the chronic nasal congestion, just as you mentioned,
Hmm.
maybe an allergy, maybe an obstructed airway, such as enlarged tonsils, adenoids. So it is important that this child should see a pediatrician, or will see ear, nose, and throat specialists.
Yes.
And if possible, it may need to also important to visit a dentist.
Mm-hmm. That's really important. Thank you so much for sharing that, doctor. And doctor, I've seen a lot of children who suddenly stop breathing during their sleep, or I think this happens majorly for babies. They can just be doing stuff and then they'll just stop breathing, like pause in their breath, and you can see them literally freeze. I've seen it quite a number of times, and I know that this can be dangerous. But I want you to tell us, how dangerous is it if a child briefly stops breathing while sleeping? And is there anything a parent can do in that moment to help the child catch their breath again? It can be really scary.
Yes, some babies stop um, can have what you call apnea.
Hmm.
You know, when sleeping. Um, Apnea is when you have sudden cessation of breathing, uh, lasting longer than 15 to 20. Uh, I think it's seconds and minutes.
Yes.
So, and during this period, there won't be exchange of air, and it can lead to some of them leads to respiratory issue
Hmm.
and cyanosis, and if not addressed on time, it can lead to death in that child. So some of them, you may need to tap the feet of the baby,
Okay.
touch them, or so that they can. Some of them forget to breathe, especially when you have extreme preterm baby.
Yes.
So you may need to touch them, tap their feet, so that they can continue
Breathing.
breathing.
Hmm.
It's common in baby that have apnea of prematurity.
Hmm.
So, and it is when there is temporary pause in breathing that lasts 20 seconds or longer. So, there are different types. So sometimes it can be from the brain, which is what you call central apnea,
Hmm.
in which the brain temporarily stops sending signals to the muscle that control breathing. And sometimes it can be what you call obstructive apnea, in which the brain sends the right signal, but there is physical blockage, like swollen tonsil, cold, or anatomical issue that block the airflow of the throat or the nose, that prevent the exchange of air. What you notice is bradycardia. The baby have a slow heartbeat. Cyanosis become blue, suddenly blue or pale. You know, then they have hypotonia, or the labored sleep. So for baby like that, they need to be treated It's common in children that are born before 37 weeks complete pregnancy.
Yes.
So, but for older babies, it maybe due to severe infection, it may be due to reflux, or it may be due to anatomical obstruction that blocks the airway. So for those kind of babies that you notice, please take these babies to see their doctor, pediatrician, as soon as possible,
As soon
so
as
that they
possible.
monitor, they
Mm.
find the cause of the apnea and treat as soon as possible.
Yes, very, very important for parents to note this in their children. Can untreated sleep related breathing problems eventually affect the heart and the lungs of the children over time? What are some of the ways that untreated sleep related breathing problems can affect the heart and the lung? And can it actually affect the heart and the lung over time?
Um, yes, unrelated sleep. I mean, untreated sleep problem
Mm.
can eventually can lead to cardiorespiratory arrest and leads to death.
Mm.
By the time there is no proper exchange of air, oxygen are taken in, carbon dioxide, are brought out, in exchange for oxygen. That's how everybody sustain life.
Yes.
But by the time uh, you don't have proper oxygenation, there is buildup of carbon dioxide, which can affect the brain, send signal, and can cause a lot of toxic buildup in the body, which may eventually lead to cardio and respiratory cessation, and that's signaling that death, eventually leads to the end of life.
Thank you so much, Doctor. You've mentioned that environmental allergies are also something, and also related to their lifestyle, maybe cold and all of that. What are some of the treatments? What treatments and lifestyle changes are commonly recommended to avoid respiratory issues in children, like snoring and all of that? What are some of the treatments or lifestyle changes that you can recommend to our parents?
When it comes to, we start with snoring,
Mm.
as a cause of respiratory uh, difficulty or breathing problem.
Yes.
And we realize that allergies uh, and environmental pollution have a role to play when it comes to development of allergies that can
Yes.
cause snoring, which leads to uh, uh, obstructive airway disease. And also, it was also found out that allergies and repeated infection
Mm.
also have a role to play when it comes to the development of adenoids and enlarged tonsils, which is the main culprit, for obstructive airway disease. So, and when it comes to allergies, as much as possible, uh, the role that we have to play is, as much as possible, is to reduce the environmental pollution.
Mm.
At home, please, let's stop. For parents that smoking, let's reduce exposure of our children to either primary or secondary smoking. Primary smoking is when probably this child, maybe as a teenager, they are smoking directly. But secondary smoking, is when they inhale uh, the whatever thing that the parents are exhaling from
Yes.
their smoking habit. You know, so this is one of the environmental pollution that are common in our homes. That can affect the development of these allergic diseases and condition. Um, we also look at dust, house mite, cockroaches, all these ones to have a role to play when it comes to environmental allergies. And
Yes.
also, majorly now, in most communities, industrialization now leads to industrial pollution, which also increase the development of this uh, allergic disease, which can affect the airways and cause obstructive airway and apnea.
Hmm. Thank you so much, Doctor. It has honestly been a very awesome conversation, but I'm hoping that every parent listening right now, they've learned one or two things and will make good use of every advice that you've given. Doctor, I would like you to give your final message to parents listening right now on things they should remember about their children who snore or breathe heavily at night. What will be your final words to those parents, and how do you? I just wanted to give your final words to parents listening right now.
I would say that mild snoring is normal and acceptable as long as it occur occasionally. But when you notice that your child is having loud, persistent, and continuous snoring at night, you know, every night to the extent that it affects their breathing, you know, they are mouth breathing, they're having, I mean, restlessness when they are sleeping. It is time for you to bring them to the hospital to see their pediatrician so that they can assess this child, find the cause of snoring, and give appropriate treatment before this child having uh, complication,
Yes.
that may affect their growth, their development, and their academic performance in school.
Mhm. All right. Thank you so much, Dr. Akinola, for joining us today and helping us better understand snoring and heavy breathing in our children. Thank you so much for being here, ma'am. It was such a pleasure.
Thank you for having me once again.
And to the parents listening, not every snore is harmless, but you need to pay attention to your children's sleep pattern, their breathing, their energy levels, and their overall behavior. Every single thing needs to be checked properly because they can be indications to something that you're not aware of. And sometimes what happens at night can tell you a lot about your child's health during the day. RadioDoctor right here on Women Radio WFM 91.7 is Nigeria's first free consultation specialized radio health program that broadcasts from Monday to Friday at 10 a.m. Do join us tomorrow by 10 a.m. for another Radio Doctor. A big thank you to the producer, Fumi Bangbala, and the executive producer, Tung Okiwale Shonaya. Thank you for listening and have a healthy day. My name is Finfolua Akiremi. Enjoy the rest of your morning. Bye for now.